Have you ever wondered why you are told to stop eating or drinking before surgery? It might seem like a strange request, especially when you are already feeling anxious. But it's one of the most important safety measures we take. NPO. Hi everyone, welcome back to the channel. Today we are diving into the crucial reasons behind that NPO or nothing by mouth order. The main reason is to prevent something called pulmonary aspiration. That's a medical term for when stomach contents like food, liquid, or stomach acid accidentally enter your lungs. Normally your body has reflexes like coughing or gagging to prevent this. But when you receive general anesthesia, those reflexes are temporarily disabled. Your body is completely relaxed, including the muscles that keep your stomach contents where they belong. So what happens if aspiration occurs? Well, it can be very serious. Food and liquid in the lungs can block your airway, making it difficult or impossible to breathe. Even worse, stomach acid is highly corrosive and can cause severe inflammation and damage to your lung tissue, leading to a dangerous type of pneumonia called aspiration pneumonitis. This can result in much longer hospital stay, a need for intensive care, and a more complicated recovery. That's why your surgical team gives you a very specific instructions. Usually you will be asked to stop eating solid food about 6 to 8 hours before your procedure. This gives your stomach enough time to empty completely. You might be allowed to have clear liquids like water or black coffee up until about 2 hours before surgery, as they pass through the stomach much more quickly. But always, and I mean always, follow the exact instruction given by your anesthesiologist or surgeon. They know your specific health situation and the type of anesthesia you will be receiving. Following these NPO guidelines is a simple but powerful way you can be an active partner in your own safety. It drastically reduces the risk of complications and helps to ensure surgery and recovery go as smoothly as possible. So next time when you are told nothing by mouth, you will know it's not just a random rule, it's a crucial step for your well-being. If you found this video helpful, give it a thumbs up and hit that subscribe button for more health insights. Stay safe and we will see you in the next video.